Hello everyone, in this video we're going to talk about Moro's reflex, and stay tuned till the end of the video because I will also explain all of the conditions where Moro's reflex can be abnormal. Moro's reflex is a neonatal or a primitive reflex. What that means is that this reflex will develop in the child during the intrauterine life, and then it will be completely and fully present at birth, and it will be fully developed when the child is born, and later it gets inhibited by the inhibitory actions on by the higher centers in the brain during the postnatal life of the child. The onset of Moro's reflex is at 28 to 32 weeks of gestation. So in the intrauterine life it will start at 28 to 33 weeks or 32 weeks. It gets fully developed by 37 weeks of gestation, and then it lasts up to 5 to 6 months postnatal. So it finally disappears after the child is born at the age of 5 to 6 months. The initial or the starting position is when the child is lying on the hand of the examiner in a semi erect position, which means that the child will be half supine, half sitting position. So it's like a halfway position between supine and sitting. Along with that, the head of the child is held or supported by the hands of the examiner. This is the initial position for this test of this reflex. Now, when the baby is in this position, our hand is supporting the head of the baby. What we have to do to elicit this reflex is that we have to suddenly let go of the support on the head and allow the head of the baby to fall back suddenly. Now, the response observed because of this sudden drop of the head is that the shoulders of the baby will abduct, the elbows, wrists, and fingers will extend. That is what happens as a response. The shoulders abduct, the elbows will extend, wrists will extend, and fingers will extend. Eventually, the shoulders will adduct back, and the elbows and fingers will flex again. This is what we see after we elicit Moro's reflex. Now, Moro's reflex is very sensitive to the level of alertness of the infant. So, Moro's reflex might be abnormal in some conditions, which I will highlight now. Moro's reflex might be completely absent in a child, which means that when the head is allowed to fall back, the child will not abduct the shoulders or extend the arms or the wrists. Now, this could be due to severe generalized disturbance of the central nervous system. So, if there is a problem with the central nervous system, Moro's reflex might be absent. And this is seen in conditions like stage 3 hypoxic ischemic encephalopathy and kernicterus. These two are the causes for absent Moro's reflex. Now, Moro's reflex might be asymmetric, which means that one side of the body might show this response and one side will not show this response. This indicates that there is some sort of a nerve problem, nerve disease, or a bone disease. So, this could be seen in a fractured clavicle. So, if the child's clavicle is fractured, the child will not be able to move the arm of that side, and so Moro's reflex is not seen on that side. Similarly, a brachial plexus injury or an Erb's palsy. If a child has an Erb's palsy, the entire arm will be paralyzed and it will show a policeman tip deformity, which I will explain in one of the later videos. In that case, also, the arm of that side will not show the Moro's reflex. Or in conditions like hemiparesis, the Moro's reflex might be asymmetric. An exaggerated or increased Moro's reflex can be seen in neonatal hypoglycemia and in babies with stage 1 hypoxic ischemic encephalopathy. These two conditions will show an exaggerated Moro's reflex.